Hello listeners, welcome to Views on Health. A great pleasure to have with me on the program today Dr. Buddhi Jayasekera, consultant psychiatrist at the base hospital in Kuliapitia. Welcome to SLBC after quite a while, Doctor.
It's really nice to come back and contribute for your valuable program.
Thank you, Doctor. So, as a consultant psychiatrist, Dr. Buddhi Jayasekera is going to focus on family conflicts, a topic we have not touched on at all. So, without any further ado, over to you, Doctor, to introduce family conflicts.
Family conflicts, in the sense why I thought it would be interesting and important for us, because it might be important for me as well, because conflicts are not that rare and it's found everywhere. Each and every family, each and every workplace, you will have conflicts. More than anything, in family you will have conflicts when you have different opinions. If it is 2 people or 3 people, any 2 people will be different. Not that the old saying, once you get married you are not 2 but 1. There is always conflicts depending on the individuality and your preferences. So what we can do when it comes to the conflicts is the most essential component, because if we don't solve it within ourselves, it might go beyond borders, where it might create into something which will dissolve the family, which will be bad for your children, which will be bad for financially as well as for your mental health, and ultimately when your mental health deteriorates, it will be bad for your physical health as well. So what we really need to do in a conflict, in a sort of a general sense, rather than taking each and every conflict differently, it might be financial, it might be relationship issues, it might be extramarital affairs, you never know. But first of all, we need to find out why the conflict occurred, and out of which, what are our common goals as well. So, if it is a family and it's between 2 individuals, may it be husband and wife, we need to focus on common goals. What are we going to achieve? Maybe we wanted to achieve something good financially. Maybe we wanted to achieve something in our children, which we are having a significant conflict over what would be the ideal thing. So that common goal should be identified first of all. Both individuals should be more concerned about identifying the common goal, or otherwise. Now, I tend to see so many people who one will be trying for a common goal, whereas the other person will not. I mean, not really a common goal, but some sort of a common goal the one individual was trying for, but the other was more polarized towards themselves. But still again, that's what you see, like in normal natural world, that's what you see. So the one who do identify the common goal should try to focus on that rather than getting yourself involved with more individualistic goals, because even though the other person was trying to push for their own, and then trying to convince the other person to a certain extent, may it not be 90%, maybe 50%, yes. But still again, if you could try to push forward the common goal, which is not like more selfish like, the other person will gradually come to you. It might take days, it might take months, but still again, ultimately you will go into that common goal where we will identify, okay, what we are trying to do is achieve some higher level for our family, get something nice for us, get our retirement more comfortable for us. So look at that, and then at the same time you need to speak more thoughtfully about what you really want to get, because you can't be too emotional. and you have to express your feelings. When I tend to hear like this, now I've got a few examples, if I may say. Now there is two individuals, husband and wife, who used to come to me, and the husband was mostly explaining things about how bad the other person was in treating him and so on. But the wife, other way around, was telling, okay, when he treats me like this, I feel very sad. I feel neglected. And then she was not saying that you are neglecting me, but saying you do this, but I feel quite neglected. So that is my feeling. Nobody could negate that feeling, because that is my feeling which I'm reflecting for. Then the husband will come and say, okay, no, I don't want to neglect you. I'm trying to achieve this. Now you are gradually coming into a sort of a common goal there, rather than if the wife says, you are neglecting me, you are treating me bad, then the husband will take a step back and say, no, I'm not neglecting, you are treating me like this, and that's why I'm doing this. So you make a conflict out of it, and at the same time, if you express your feelings and emotions more than anything, then the other person will try to understand, okay, this person may be feeling little bad because I try to treat her like this. I never intentionally do it, but my intentions had made them sad. Even my good intentions have made me sad. So that is one very important way of handling this sort of things. We'll go further on this, but those are the two major ones which we need to discuss here.
Doctor, how receptive are your patients to this approach to finding the common goal? Now, you did say that, gave an example of a couple just a few minutes ago, and the way the wife responded, you said would help to go towards reaching the common goal eventually. Whereas if she had put it in a different way, it could have escalated the conflict, aggravated it, whatever. So this common goal is something, from my perspective, you're the expert here, I'm just a lay person, is something very fluid. You can't say this is the common goal. I mean, yes, you have a common goal, like okay, if it's between the two adults and they have to say where they are heading. If you take the child and you say the child's maybe a course of study or an extra curricular activity the child wants to do, the father might say it's good, the mother might say no, and so then there's something where you have to work towards a common goal. So this common goal is something that from our perspective is like it's there, but then how do you go towards it? Obviously to come to you, to an expert, to a consultant, psychiatrist, to guide them, direct them.
Yes. Yeah, that creates a, when you look at, okay, for instance, now your child wants to go for football, and the mother says, no, I don't have time on that given period. He needs to do his homework also. How can we try to solve this? Then the common goal is, let the child achieve what we really want. What are we trying to achieve through homework, and what are we trying to achieve through that football? So the common goal comes even after that. What the child really wants, and what we as parents want the child to have, what skills the child want to have. So then probably if you say, okay, we want the child to develop more social skills, life skills, to work as a team, then we might shift from football, but we'll try to achieve whatever that common skills that we really want our child to achieve. So it might be educational, academic, yes, But at the same time, each and every parent will understand that child needs to be in a group when he comes to a office or when he wants to climb up the ladder and be a executive or somebody who handles people. He needs to have these life skills and social skills for his future. That's a common goal. So even though we have a conflict on layers after that, the common goal is much higher. Probably if the conflict comes, it's always important to go for the much higher common goal and come down. Then still you will come into a same sort of level in one stage, where after that you might go on different directions. So it's sort of important skill to have for a family, for a child. May it be parents, yes, but for a child this is very important. If you have, as parents, have practiced that and the child sees that, okay, my parents are resolving issues like this, that itself is a good example for the child for future. Because mind you, the new world is full of people, may it be through internet, may it be other digital medias, but you need to handle a lot of issues. So that skill is very important for everybody.
It does make sense, Doctor. Thank you so much for being so clear on how one needs to approach a conflict and taking a whole family into consideration, not just the husband and the wife. Obviously, there will be a child. So the interest of the child has got to be certainly given importance. And of course, there are times, Doctor, I'm just asking you hypothetically, of course, there could be a situation where the child is going for something that is really not good, detrimental to him or her. And then the parents would be on one side saying, no, you can't do that. It's not good for you. The child might say, no, I want to do it, because the child feels friends are doing it. There could be peer pressure, which is something you have addressed in the past. In such situations, it will be very tricky to reach a common goal.
Yes, that is another very important aspect, because day in, day out, you tend to see quite similar situations in life. So the first thing as a parent or parents, if I may say, would be to understand their story as well, rather than quickly going into a decision or sort of stance where you want your own way, or put in say, no, I don't want to hear about this even. No way that we are not allowing it. That's the exact words that most of the times parents say. No, you have to listen to the parent and we are the final. So then the child has no sort of way out, even to explain themselves. So the first thing would be to relax and listen to their story. However much you feel the urge to interrupt him, to tell him this is not right and this is what I want, try to listen to their story. That itself gives you something like a 30 to 50% chance of achieving what you want, because the child do understand, okay, my parents are listening to me. Number one, now most of the time when children come to me, day in, day out, I have to see kids in their teens, especially early teens to late teens and adolescents, that who come and tell me, my parents don't listen to me. I just wanted to explain and tell them what I want and what life is. They don't understand me because they don't listen to me. So just listen to them first. And then maybe you might not be the ideal person to give a complete decision. Always think that there might be certain other adults also who are suitable to sort of give certain opinions. Well, it's ultimately a collective thing where you try to help your child. achieve something better from their current situation to another level. So always ask for another adult's opinion. Maybe you might be able to give the decision a little late. Maybe not today, we will discuss about it over the weekend also and come into a conclusion. That might be your answer. Don't hesitate to feel as if, like most of the time parents feel that if I don't give them direct answers straight out at that time, they might feel as if I'm not a suitable parent, I'm not firm, I'm not a very sort of strict parent. So you, out of that emotion, you might come into very bad decisions which might create a conflict, as well as the relationship between your child and you might be broken. So there might be situations that you might be better off asking somebody else also. May it be a teacher, may it be one of your educated relatives, or a person on that particular field who will be really good in and experienced in answering you. And the other one is, figure out what you want from that. Like, try to figure out, what am I trying to achieve through that? Whether do I want to show that my child can achieve these skills from it? Or do I want to, at times, if you don't think about it, sometimes we want our pride to be restored. Maybe sometimes because my friends are sending their children and I feel as if I'm not much financially and otherwise equipped, that I need to send them. Maybe some goals which are, the ulterior motives are within me, so don't let that happen. And then at the same time, stop yelling at them, even though you feel like, tell me about it, at times parents will feel as if you have to yell out of, like, till your head explodes to an extent when something comes in where it looks so irrational from your child. But still, do not yell at them. And then at times it would be better to pick a good timing for discussion. Good timing to tell your child, or maybe other partner even, what you really need in them. And maybe brew some tea or coffee and keep it on the table and enjoy the coffee in a relaxed manner, because a beverage of whatsoever, like even water, would give that feeling that, okay, we are just in good terms, we are discussing in good terms rather than out of anger. And sometimes when things go really wrong, you might feel as if, as I told you, to yell. So take a deep breath at that time and try to calm yourself before you tell anything. And so on. Those are the minor things, but ultimately make a big move out of it.
This may not be a fair question, but if you take in your practice, doctor, you have gone, I'm sure, hundreds of cases, thousands of cases. Just a ballpark figure. Like, how long would it take to resolve a conflict? I mean, to get it into them that your approach should be this, very, very gently, move towards the common goal. How would it take time? Okay, it depends on person to person, of course, but on an average.
Yeah, if you go into the correct approach where you tell your emotions and you try to tell them about your emotions and your common goals, and not anything about you, it's about how you feel and what you feel might be wanted if they can give it to you. And probably I'm adding into it that you need to tell them how much you love them. So that also makes the sort of ice, in between the two. Because now then it's about how you feel, because you love them also. So there is a sort of reciprocal emotion which is coming in, which is building up. If you go that way, probably to resolve a conflict, especially with children, which you may need to do it quickly, it will be just 2-3 days. And even though with your partner, which might be a much bigger conflict, a much bigger sort of events and needs, still you could get somewhere around 25 to 50% within first 5 to 6 days, which is something bigger compared to what you've been having for quite some time.
So would you say that once within this short frame of time, 5 to 6 days, or you said 3 to 4 days, it's very encouraging that one can come to an understanding to reach a common goal. Having that within that time frame, thereafter what would happen, doctor? Could it have a reversal if either party again goes into some area that they shouldn't? These things can happen, we're all human. The positive side, progressing from there. How does it work?
Yeah, that's another good question. Really speaking, if you try on the common goal and trying to resolve the conflict, it will naturally go maybe much slower than the very beginning, but it will go on. And you will be reaching some sort of a compromise, which is for the betterment of the family, within a reasonable time frame, I suppose. But at the same time, as you correctly said, always there are certain issues, certain negative feedbacks maybe from our own or maybe from outside even, to say that we will sort of go back a little. But when you have told them, the other party, that this is out of love that you are doing it, and you are not being selfish also because you are thinking about the other, and expressing yourself what you really need, and at the same time expressing how you feel rather than inflicting sort of certain I may say certain wrongdoings which others have done to me, or directing them that, okay, you have done this to me, that's why I'm feeling like this. It's always better to say, I feel like this when I see this. So that's me rather than anybody else, but again the feelings which I have. So there is a progression rather than going back, because nobody could challenge you. No, I didn't do that, or I didn't try to do that. They will always tell you like, okay, I didn't mean that. Sorry I hurt your feelings, but I didn't mean that. So then they will be extra careful not to make sure that the same mistake will happen. So it's building up. It's building a relationship between two people, or maybe 4 or 5 people within the family. So, and the most important thing out of all is giving your children an example how to resolve things in life. They may very well use it in school. They may very well use it when they are in team sports. After all, they might very well use it in their life.
So what you're saying here, doctor, is the choice of words also important.
Exactly. Choice of words and expressing our emotions, more emotional intelligence into life.
Doctor, it's so interesting, and I think it's such a wide topic. We can talk, I think, for a longer period of time. But unfortunately, time has caught up with us. So what is your take-home message to our listeners out there?
Yes. Always identify that you all are trying to achieve something for your family rather than you are trying to achieve and the other person is trying to drag you down. That itself will help you to go into a common achievement and much higher status in your family as a whole.
Thank you, Doctor. And there we end this interesting discussion on family conflicts. And we thank you, Dr. Buddhi Jayasekera, consultant psychiatrist, Base Hospital, Kuliapitia, for being with us on the program today. Thank you, Doctor.
Thank you so much.
Thank you too to Prabha Veerasurya for technical assistance. I'm Fatima Razi Kader, saying good night. And looking forward to your company next Monday, same time on Views on Health.